I'd like you to grab your small trigger ball. Now this can be a tennis ball, that would be a very gentle version, or a lacrosse ball, or they make specific balls for trigger work, which our goal is to massage fascia that's tight to release and dissipate muscles that have gotten into knots. So you're going to take that ball, put it under your foot. You can stand by a wall and you're going to roll out each foot one at a time. So stand by a wall and you'll notice as you're working into the foot areas that you're tight. Maybe it's your arch, maybe it's the ball of the foot, maybe it's the heel. Depending on your posture, most likely if you sway back, the outer edge of the foot is a little tenderer than the inner edge. And with our kyphotic, lordotic, and lordosis, because of the pronation, we're going to see the inner edge is tenderer. As you're doing this, you can be as aggressive as you can tolerate because you want to get into that foot so that you have better proprioception as we start to balance and move through space. So let's go ahead and switch sides, rolling out that other foot. And this feels so nice. And if you're fatigued from being up, feel free to sit down as you're doing this. You don't have to be standing, whatever you'd prefer. Our next exercise is standing, so you're going to have to make your way to a wall, but we have about 30 seconds. So be where you are, getting into those feet, warming them up before we begin our standing work. So we're going to do a nice pec minor and anterior deltoid opener as well as a little upper back strength next. So that ball can be set to the side and you're going to bring your back against a wall. So you may have to, in my case, I removed a couple pictures to do this, but hopefully you have a little wall space where your back can rest against the wall and you can bring your arms up to a high diamond. So a high diamond above you. Bring your arms up and see if you can get your arms into the wall. So the backs of the shoulders. You may have to walk your feet forward a bit, but see if you can get the upper back, the mid back to press into the wall. From here, slowly, one arm at a time, we're going to pull one arm down so that the elbow pulls all the way into the side body. So it bends, pulls in, and then goes back up. So it looks like this, slowly pulls into the side of the body, and then it comes down. So as you're doing that, watch out for the shoulders. Keep them plugged down. Exhale to pull down. So it mimics a lat pull down. If you were holding a bar and you were pulling it down, it would be the same motion. So you're getting the same muscles that recruit in a lat pull down here. But you're having to keep that imprint and not over-recruit those overactive pec muscles. This can get very tiring. Hang in there. You got a little longer to go. So staying on that same side, and then we'll switch in 10 seconds here. One arm is imprinting, the other is moving. Go ahead and switch sides. Inhale, prepare. Exhale, pull. And it's slow. Inhale as that arm comes up, pelvis pulls down in opposition. Exhale, inner thighs pull back to the wall to bring you onto your feet, helping you find those inner thighs and that lower pelvic floor. Another minute here. If you need to take a little forward fold of your upper back, you can keep your tailbone, your sacrum area connected to the wall, and you can fold your upper body forward just for a release. If not, you got another minute here. Keep going. Keep working that upper back strength. Nobody wants rounding in the front of the shoulders and to look like they're slouching or slumping. Roll those shoulders back. Fight to imprint the entire upper back into the wall, the backs of the arms. You're really pushing the shoulder blades into the wall, building that strength. 30 more seconds here. Low abs are lifting in and up. You hear that breath. Focus is up a little higher than eye level. Soft bend in the knees, not locking out. Each inhale as that arm raises up, imagine me pulling your pelvis to the floor. Your obliques get longer. Each exhale, you pull your inner thighs towards the wall, bringing you solidly onto those feet. 5 more seconds. Hang in there. 3, good, 2, and 1. All right. Take your second to lightest loop band around your wrists. And we're going to step in the frontal plane, which is side to side, boom, side to side. And as you're doing that, you're going to step to your knee flexion. Pull out on the band like so. You're going to step and find knee flexion. So step to the side, find knee flexion, hold knee flexion. You can always do this by a wall bar or counter for your safety. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Step to the other side. Find the balance. Hold. Inhale 1. Breathe. Reach the arms forward. Exhale 1. Inhale 2. Make sure your pelvis is back if you have sway back or flat back. Exhale 2. Toes are pointed. Inhale. Good. Second time on the first side. Travel through space. Find the balance immediately. Soft bend in the supporting knee. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. Hold it. Inhale 3. Exhale 3. And last time, step to balance. Hold. Inhale 1. Breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Great. So from here, we're going to come over to the wall for a stretch, okay? So you're going to bring your arm onto the wall for a pec stretch. You'll twist away from that arm, so place it against the wall, and then twist away to open up your pec major. Soft bend in your knees, lift of the chin, hold it here. Inhale. And exhale, twisting a little farther away from the arm. Good. Inhale. And exhale, twist. One more breath. Inhale. And exhale, twist. Switch sides, setting up on the second side. So start with the arm in a T and then twist away from that arm. Breathe here. Inhale. And exhale. Inhale. Exhale. One more breath here. Inhale. And exhale. Turn and face the wall, bringing both hands on the wall, chest tight. Get very close to the wall. Almost your chest should almost be touching it. And now step one leg back so you're in a lunge. Push your pelvis forward, and you'll notice a stretch in your calves of your back leg. So if you need to widen the stance to feel the back leg's calf, you can widen that lunge. Push that pelvis forward. Keep your focus up. Keep your abs in. We'll be here for a minute. If at any point you need to come sit down and relax, get some water, do that. Be where you are right now. But the calves tend to be a major issue for flat back and sway back, and they can limit mobility. They can also be pulled pretty easily because of their overactivity. So it's great to stretch them out if you have these postures. And KLP and LP, you can benefit from it as well due to the type of training we have to do to combat ALS. So breathe here. Couple more breaths. All this balance work, you definitely want to stretch the calves after. Take a nice inhale, stepping forward. Exhale, step the other leg back. Driving the pelvis forward. So as you get more familiar with YouniquelyFit's programs, you'll recognize that when we're doing a postural stretch, and postural stretch means due to your skeletal structure, these muscles will constantly be tight until you learn to strengthen the other muscles that are not firing. So calves are a posturally tight muscle for sway back and flat back. So breathe here, inhaling and exhaling deeper into that posture. Inhale and exhale. And you can always take the hands to the hips. You don't have to have the hands against the wall. No need to strain the upper body if it is. Breathing, inhale and exhale. Last breath here, inhale and exhale, stepping forward. Great job. We're going to move into some squats. If you can grab your small anti-burst ball and your second to lightest loop band, you're going to bring your back against the wall, the ball between your inner thighs. So small anti-burst balls about this big. If you don't have one, you can just keep your legs hip distance apart, or you can get a pillow. You can squish it and squeeze it between your inner thighs. So let's take that loop band and stretch our arms out in line with our chest, and we're going to slide down the wall into a squat, keeping our back attached to the wall, walking the feet forward. Hold that squat, and if this is too much, just stay where you are. Take some deep breaths. Focus on some diaphragmatic breathing. Inhale, 2, 3, 4, 5. Breathing into the belly, and exhale, 2, 3, 4, 5. If you're in your squat, you're taking the arms up overhead, and as you stand back up, you're pulling them back down in line with your chest. So we exhale to sit back into that squat. Hold at the bottom. Inhale, 1, breathe. Exhale, 1. Inhale, 2. Exhale, 2. And then we inhale, stand up, arms come back down. So our goal is to imprint the upper back against the wall when the arms come up. And we're at a right angle with our thighs and shins in that squat, squeezing with the inner thighs, that ball, building up the quadricep and adductor strength. 2 breath hold at the bottom, and then we rise back up. Exhale to lower down, hold, inhale, 1, breathe. Exhale, 1. Inhale, 2. Exhale, 2. And inhale to lift. 2 more sets. Take it down, slowly lower down. Hold, inhale, 1, breathe. Exhale, 1. Inhale, 2. Exhale, 2. And inhale, lift up. And last set, taking it down. Hold it down. Inhale, 1, breathe. Exhale, 1. Inhale, 2. Exhale, 2. And inhale, lifting back up. We're going to move into some balance work through the transverse plane of motion. Now, the transverse plane of motion is where 90% of injuries occur. This is when we turn. So it's imperative that we train to combat this. So if you have kyphotic, lordotic, or lordosis, you'll be doing your hamstring curl with the second to lightest loop band. If you have sway back or flat back, I'd like you to find side knee flexion. So it's no longer in front, it's now out to the side, external rotation. So we're facing 12 o'clock with our body. We're going to take a quarter turn and lift the leg to side knee flexion, or a quarter turn and lift the leg to a hamstring curl if we're lordotic or kyphotic lordotic. So we have our side knee flexion for flat back and sway back, and we have our hamstring curl for KLP and LP. Make sure your band is around your ankles, and if you're doing the if you're doing the hamstring curl, you're bringing the foot inside the band, the arch of the foot inside the band. Otherwise, it's going to stay around the shin. Everybody is pointing their toes except flat back, you're dorsiflexing your feet. Okay, starting at 12 o'clock, you're turning either to 3 o'clock or 9 o'clock, hands on the hips. Give me that quarter turn, finding your balance in side knee flexion or your hamstring curl. Find that balance, hold. Inhale, 1, breathe. Exhale, 1. Inhale, 2. Exhale, 2. Try to hold it. No moving from one side to the other. Inhale, 3. Exhale, 3. Step to balance on the other side. Find it. Inhale, 1. Pelvis pulls down. Exhale, inner thighs pull back. Inhale, pelvis pulls down. Ground yourself. Exhale, inner thighs pull back. One more breath. Keep your chin up. Inhale. And exhale. Take it back to the first side. Quarter turn. Find the balance. Hold. Inhale, 1. Breathe. Exhale, 1. Inhale, 2. Exhale, 2. Inhale, 3. Exhale, 3. And final time, stepping through that plane of motion, preventing your injuries by working unilateral balance in the transverse plane. Hold. Inhale, 1. Breathe. Exhale, 1. Inhale, 2. Exhale, 2. Inhale, 3. And exhale, 3. Great. From here, We're going to grab that second to lightest band and bring it around our upper arms above our elbows. And we're going to come into a sumo squat. So a sumo squat is a ballet second. So it's a low squat with external rotation of the legs. The arms are going to be up here. We're going to lower down. Inhale, exhale, pulse. 2, 3, 4. Inhale, exhale, pulse. 2, 3, 4. Inhale, lift. Take it down. Exhale, pulse. 2, 3, 4. And inhale. 2, 3, 4. And pulse. 2, 3, 4. Inhale, lift. So there's 2 full breaths at the bottom, and then we come up on the inhale. Take it down and lower down. Hold it down. Pulse. 2, 3, 4. Pulse. 2, 3, 4. And lift. Good. Exhale down. 2, 3, 4. Inhale. 2, 3, 4. Stay down. Exhale. 2, 3, 4. Inhale. Lift. And lower down. Exhale down. Hold it down. Pulse it. Use those low abs. Watch out for the knees bowing in or out. Let them track over your second and third metatarsals. Brace your abs to do this. Tip your tailbone back if you're sway back or flat back. Pull those low abs in. Keep going. Shoulder blades together. Just 20 more seconds. Use your breath. Hear that Darth Vader-like sound. Retract your shoulder blades. 15 seconds to go. Come on. Push yourself. This is for your cardio health. This is for your inner thigh strength, your balance, your glute strength. 5 seconds. Almost there. 4, 3, 2, 1. Great. Put that band to the side. Come to sit in a chair. We're going to work on your hands for a moment. So we're going to do a 5 count hold. So I want you to grip. We'll start with your dominant hand, okay? So gripping that dominant hand as hard as you can for 5 seconds, and then you're going to release for 5 seconds, okay? So we're gripping. 2, 3, 4, 5. Release. 2, 3, 4, 5. And grip. 2, 3, 4, 5. And release. 2, 3, 4, 5. 2 more sets. Grip. 2, 3, 4, 5. And release. 2, 3, 4, 5. Again. Grip. 2, 3, 4, 5. And release. 2, 3, 4, 5. And let's switch sides. If you need to roll those shoulders back, if that was intense at all for you, please do so. Go ahead, set up on the other side. Give me that fist. And here we go. Inhale, grip. 2, 3, 4, 5. Exhale, release. And grip. 2, 3, 4, 5. Release. 2 more sets. Grip. 2, 3, 4, 5. And release. And one more time. And grip. 2, 3, 4, 5. Release. Other hand. Roll that wrist out. Give me 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Roll it in for 10, 9, breathe 8, and 7, 6, 5, 4, 3, 2, 1. Flick the wrist as if you're saying bye, later. Keep that going. That's it. And switch hands. Start with that circle out. Give me 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Reverse it. Give me 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And now we flick for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great job. We're entering our final series, our final 10 minutes together. So you're going to have your second to heaviest loop band around your outer thighs. And I'd like you to come over to a wall. Now, you're going to have your foam roller behind you for this, and you're going to use it for your lunges. Now, this is a rather challenging exercise. For some people, it's better to get a slider disc or a washcloth and put that under your back foot and just slide that back and forth because they tend to lose the foam roller. So the foam roller is behind your back foot and you're sliding back and forth in a lunge. And we're going back and forth, and we're obviously going to stay on one side because it's difficult to keep switching sides. So come to a wall bar or counter for safety's sake and hold on to it with one hand. Put the other hand on your hip. The band is around our outer thighs to help us find that hip distance and keep our abductors of the legs engaged. So I want the low abs pulled in, and I want you sliding back. It doesn't matter which side you begin with. Oftentimes I find that it's a little easier to start on with the leg forward on your dominant arm side because that leg is going to usually be more flexible, so you're going to go into that lunge a little easier. So keep that going. We're lunging. We're on one side. We either have a slider disc or the foam roller behind on top of our foot. Everybody's going to have to point their foot here just to keep that roller. I think flat back posture, it would benefit you more if you used the slider disc. That way you'll be able to dorsiflex your foot. That'll help combat that plantar flexion in your ankles. So flat back posture, I'm going to recommend losing the roller and staying with the slider disc or a wash rag. Continue where you are. And I'd like everybody to switch sides now, setting up on your second side. If you're feeling knee pain, just make sure you're using your low abs. I often notice when people are checking out with their midsection, all the weight of the body goes into the joints because you're sitting into it. So if you can actively use your breath and your lower pelvic floor, pulling the core in like you're going to be punched in your gut, sometimes you can make a staccato sound on your exhales for a while to find those abs, those lower abs, because they should be working to support you. Then you don't have to take the pressure in the joints. So keep going. We're on our second side. You're doing wonderful work. Slow tempo, slow down. Let's work slowly to build strength. We already raced through the day in a lot of other areas of our life. Let's take our time here. Exhale down. Inhale up. So that breath as you go back into the lunge slowly, you've got your ujjayi. As you come up, you have your inhale as your pelvis pulls down. Exhale back. Inhale up. And we exhale back. Inhale up. And this outside arm, if it feels better, you can take it up to shoulder flexion, palm facing in. Shoulder down the back. Make sure that chin's not falling forward. Where's your gaze? Make sure your gaze is just a hair higher than eye level. Pull the low belly in towards the spine. Hear that breath. 10 seconds to go. Remember how important the abs and breath are to keep your back safe and to also keep your joints safe. Bring it in. From here, second to heaviest loop band around our upper arms above the elbows. So actually, and we're going to then put the forearms on our foam roller, bringing our body against the wall, legs together, and we're going to hold a plank. So we've got the second to heaviest loop band above our elbows. We pull out on it. Forearms go onto the wall on the roller, and you walk your legs back, feet hip distance apart, and we hold this modified forearm plank against the wall. So holding this plank, breathing here. I want to hear those inhales and those exhales. So the closer the legs are together, sometimes the harder it is, the farther apart they are, and the farther you walk back, obviously, the harder it is. So keep your chin up, keep your abs braced. If you feel any back discomfort, bring it in or open the legs wider. Soft bend in the knees. Now play around with kind of rolling the arms up just an inch and down, engaging your upper back to do that. Inhale the arms up an inch, exhale them down. Inhale them up, exhale them down. Inhale up, exhale down. One more. Inhale up and exhale down. Great. Our final balance exercise. We're not going to need any equipment for this, just a wall, bar, or counter close by for safety purposes. So this is a great way to open up the hamstrings to test your low ab strength and your balance. We're all going to take our arms out to a T. We're going to step forward through space. So we're stepping forward and back in the sagittal plane. And as we step forward, we're going to sweep our leg forward and back. So it's going to go forward and back, sweeps, little sweeps of the leg, trying to stay lifted through our core, holding our arms out to the side. So we'll inhale, exhale, sweep, 2, 3, 4, pause, inhale, exhale, sweep, 2, 3, 4, and inhale, exhale, sweep, 2, 3, 4. Step forward on the leg that was sweeping, switch sides. Inhale, exhale, sweep, 2, 3, 4, and inhale, exhale, sweep, 2, 3, 4, inhale, one more, exhale, sweep, 2, 3, 4. Now the challenging part. Now make sure when you're sweeping that leg, it can be parallel, but it can also be turned out. And if you've had a hip replacement, you just want to watch out for turning the leg in. You don't want the leg crossing the line of the body. You're going to make sure that you're turning out the leg in the hip socket or keeping it parallel. So now we're stepping backwards through space. So you step back onto one leg and sweep that leg back. Immediately begin those sweeps. Inhale, exhale, sweep, 2, 3, 4, and inhale. Exhale, sweep, 2, 3, 4. One more, inhale. Exhale, sweep, 2, 3, 4. And last time, stepping back, flat back posture. You always have the option to flex your feet as you're working. Everybody else, point those toes. You want to send that energy through the legs. Inhale, exhale, sweep, 2, 3, 4, and inhale. Exhale, sweep, 2, 3, 4. One more time, inhale. Exhale, sweep, 2, 3, 4. Great. Final stretches. Come over to the wall. Bring your arm into a single arm cactus. So face the wall, so your chest is basically on the wall, arm is in a single arm cactus. And now twist away from this arm, pushing the forearm into the wall, and then leaning forward and away from the arm. You'll notice a nice stretch in the upper shoulder, pec minor, maybe intense. If it's intense, breathe. Don't push too hard into it. Just be where you are right now. Couple more breaths. Using those inhales and exhales. Let's switch sides slowly. Set up on the second side. Good. Bring one hand to your belly. Diaphragmatic breathing. Push your belly out here. Inhale, 2, 3, 4, 5. Let the belly fall back towards the spine. 2, 3, 4, 5. Inhale, push it out. 2, 3, 4, 5. Exhale, let it fall in. 2, 3, 4, 5. One more time. Push it out. 2, 3, 4, 5. Let it fall in. 2, 3, 4, 5. Great. From here, come to sit in your chair. We're going to close our eyes and do just a little relaxation to close our practice. So, option to bring your hands into this position where you interlace your fingers and you put your thumbs together, and you can rest the hands right on the thighs, plug the shoulders down. This opens up your throat chakra, allows you to speak your mind and be your authentic self. So let's close our eyes, and I want you to visualize a shade of blue that you associate with some sort of body of water where you've visited, vacation spot, a childhood memory, or perhaps a destination you long to go to. Put yourself in that blue water, and keep your eyes closed here. Take a deep inhale and exhale. Smell that air around you. Again, inhale. Look at that blue. And inhale. And exhale. Feel the water or the sand or the wind. And last breath, inhale. And exhale, let the eyes flutter open. You can always come back to this spot, come back to your breath whenever you're feeling overwhelmed. Great work.